You're listening to episode 61 of A Whole New You podcast. On today's show, Dr. Kabran Chapek joins us to discuss concussions and traumatic brain injuries. His new book, Concussion Rescue, provides practical, effective protocols for treating both acute concussions, or TBIs, and the chronic effects from past brain injuries. He outlines why traditional treatment protocols may not go far enough, and he offers advice and first aid for the brain procedures that anyone can use if a head injury is suspected. We discuss the roles of supplements, diet, exercise, sleep, and other natural treatments aimed at healing the brain and reducing inflammation. Welcome to A Whole New You podcast. I'm your co-host, Kim Maravich. I'm a registered nurse and author of the book 360 Health. I'm joined by my dear friend, Lori Biddle, a health and wellness coach certified through the Institute for Integrative Nutrition. Our show exists to inspire and empower women to take charge of their health, with weekly tips and conversation about self-care, mindset, nutrition, fitness, and clean living. Please keep in mind that the material provided in this podcast is intended as general information only and should not be used as a substitute for professional medical advice, diagnosis, or treatment. We're thrilled to have you here. Let's get to the show. Welcome back, everybody. Today, I am pleased to have Dr. Kabran Chapek with me on the show. Dr. Chapek is the author of Concussion Rescue, a comprehensive program to heal traumatic brain injury. He is a staff physician at the Amen Clinics, which has been the front line of defense against the impact of traumatic brain injury for over 25 years. A graduate of Bastyr University in the Seattle area, he is an expert in the use of functional and integrative treatments and collaborates extensively with many of the Amen Clinic physicians. He has a special interest in traumatic brain injuries, the assessment and treatment of Alzheimer's and dementia, PTSD, and anxiety disorders. He has additional training in the assessment and utilization of hormones to treat traumatic brain injuries in combination with SPECT imaging and the Amen method. Dr. Chapek is the founding president of the Psychiatric Association of Naturopathic Physicians, an affiliate group of the American Association of Naturopathic Physicians. He lives with his family outside of Seattle, Washington. Dr. Chapek, welcome to the show.
Kim, I'm so excited to be here and talk with you about this. It's an important topic.
Yes, it certainly is. I just finished reading your book the other day, and I was telling you off air that the book is so well written, that it's so interesting. I myself don't have a lot of personal experience with concussions, but I would recommend this book to everyone because there are so many important takeaways, so many things that we need to consider. Especially, I'm thinking I have two young boys who are just beginning to play sports and just beginning to, jumping off couches all the time. And this is a wonderful resource to have in your back pocket for, immediate attention for concussion and even for something as significant as a major traumatic brain injury. So just a wonderful, wonderful read.
Thank you so much. I mean, yes, I don't think anyone escapes traumatic brain injury, either yourself or a loved one. I mean, the rates have gone up to nearly 3 million Americans go to the emergency room every single year. And that number has doubled from 2006 to 2014. And, that's just those who go to the ER.
Yeah.
And that's one of the common myths of traumatic brain injury or concussions is that if you haven't gone to the ER, then it wasn't that serious. It's not going to cause problems. There was a pastor that was in a car accident, got checked out at the emergency room. They said, "Hey, you're fine. There's no brain bleed." He went home. 2 weeks later, he couldn't write a sermon. Just brain wasn't working. So there can be a delayed onset and it can be minimized. So he didn't assume it was from the car accident. He thought, I'm just getting older. Maybe I just can't preach anymore. But if the ER doctor would have said, you've had a hit to the head, looks fine. However, if you see any changes in the next couple of weeks or even month, remember back to the injury to your head that might have been part of the problem. So that's what I'd like to see, that change, that perspective change for how we view concussions and traumatic brain injury.
Right. I think that's something important to consider because I think we think of the immediate aftermath.
Mm,
If someone, especially if they haven't lost consciousness,
right.
oh, that they're fine, they can continue to play, maybe rest the rest of the day or,
Mm-hmm.
that week. And in your book, you clearly outline that things can come up years to decades
Mm-hmm.
after
Yeah.
a concussion or a head wound.
Right.
And so it is very
Mm-hmm.
important for us to know those signs and symptoms.
Yeah.
But before we get into talking about the specifics of your book, tell us just a little bit more about yourself
Oh.
and how you became specifically interested in the brain and mental
Mm-hmm.
health.
Well, I'm from Kansas. That's where I grew up.
Oh.
And my parents are some near you, or was near you, grew up near you, where you're at.
Uh-huh. Yep.
Um, and my parents were interested in health, and they taught me about, I thought it was just amazing how they taught me about natural medicine to help me feel well. Like when I was sick, Vicks Vapo Rub, simple thing.
Mhm.
I could breathe when I was sick, and it was amazing to me. And it gave me some books on herbs. I read and read. I was just so fascinated in how you could improve your health by just things you could do every day, simple things. Eating well changed how I felt. And I then studied naturopathic medicine, as you mentioned, at Bastyr. And then I started working after I graduated. Actually, the same day I got my board results, my son was born.
Oh,
It was a
that's
wonderful
wonderful.
day, an
Mm.
exciting day, and I felt a lot of pressure. I needed to get a job. And so I was looking and found a job at a treatment center where we were treating folks with addiction, um, substance abuse, depression, severe depression, anxiety, and I loved it surprisingly. But it's kind of was going back to why I got into this. I love to help people feel better by using natural treatments as much as possible, diet, exercise, nutrition, supplements, medications if needed. Medications definitely have their place. Uh, and I kind of came full circle. So I loved the work that I do. I worked there, became medical director at this treatment center, was there for 6 years. Wonderful experience, trained by psychiatrists, worked with counselors, and then started working at Amen Clinics, where I've been the past 7 years, really delving into brain work. And the more I do it, the more I love it. So that's how I got my start.
And, for our listeners who have not heard of the Amen Clinics, it is one of the foremost wonderful clinics that is geared towards brain health. I just heard
Thank
Dr.
you.
Amen on a podcast the other day. I was listening
Mm-hmm.
to. So he's a very famous name in the
Mm,
naturopathic community. But
mm.
I'm just so honored that you're a guest on our podcast.
Oh, it's my honor to be here and to share this information because more people need to know.
Yes.
The current approach is just is fine, but we don't go far enough to help people with concussions and brain injury. It's my sort of hyper focus right now. But there's other mental health issues that um, there's a lot of stigma. I think that's one of the things. Dr. Amen started doing this work 30 years ago. He's a psychiatrist, and he said, we need to look at the brain of our patients instead of just talking with them. And every other specialty looks. Gastroenterologists
Mhm.
do endoscopy and
Mhm.
colonoscopies. Why don't we look at the brain? It's just a light bulb went off. So since then, we've scanned everyone's brain. So we have a database of 150,000 brain scans, and so we can compare patterns, and so patients come in. We can look at, are they um, healthy? Are they too active, underactive? We use a type of imaging called SPECT. It stands for single photon emission computed tomography. This is a scan of blood flow to the brain. And it's different than an MRI, which is more structural, looking at the pieces. SPECT
Mhm.
looks at function, and it tells us, is the brain too active, underactive, which areas may be damaged. And for brain injury, it's very sensitive at picking up, and whereas MRI isn't. And that's one of the things. You go to the ER, your loved one has had a MRI or CT, which is the first thing to do to rule out a brain bleed. But if you're told it's normal, it may not be normal. There might still be injury. There's a study done in the journal PLOS ONE in 2014 where they reviewed 2,600 people with brain injury and found that SPECT imaging picked up, in some cases, 94%, which were missed on CT and MRI.
That's amazing. I think it's very telling. In your book, you have actual photographs of people's brains through the SPECT imaging, and I think,
Right.
as you mentioned, it's important probably in the acute aftermath to have that MRI or CT scan
Mm-hmm.
to show if there is a bleed. But if you're doing an MRI or a CT scan 20 years
Mm-hmm.
later, that won't show anything, but the SPECT scan
Mm-mm.
shows actual divots. You can see in your book that it looks like there are crevices or holes
Mm-hmm.
in parts of people's brains that have suffered traumatic
Yes.
brain injury. So that's
Right.
an important tool that probably isn't widely known and may not
Mm-hmm.
be as widely available as we would hope.
Right, right. No, that's exactly right. And the holes that you see, of course, they're not actual holes, but it looks like that, and it's
Mm,
decreased blood flow in areas that are clearly damaged. And so,
mm,
what helps people, we use SPECT imaging in two ways. It's diagnostic, it helps us understand where the damage is. And second, it's therapeutic and decreases stigma because that's the problem. People do not see the brain. Not to get too political, but Trump recently mentioned something about
mm,
minimizing veterans' brain injury, where there had
mhm.
been a missile attack in Iraq. And he's not alone. I mean, it's easy to, because you don't see the injury. And
Right.
so even the person who's suffering may think, okay, maybe it's just in my head, or I'm not trying hard enough, and their family members aren't sure what to do with them. All of a sudden, a kid who's in school can't function. But once we scan their brains and look at the injury, it helps them to see that it's a medical problem. It's not a trying hard enough problem, or it's just depression, or it's
Right.
dementia. It's actually a brain injury.
Right,
So,
which is fascinating. We are going to talk about that too. In your book, you refer to traumatic brain injuries as the silent epidemic. Is it
mm,
because of that? Because we
mhm.
don't necessarily see that aftermath right away, or explain what you mean by that?
Right. There's a lot of reasons. Part of it is because we don't see the injury and we minimize, um, and we just think, and this it's an epidemic because there's so many people who have it, and the damage is cumulative. So one hit to the
Mhm.
head um, long ago may not be that bad, but then you hit your head again and again, and it might be like the straw that broke the camel's back that eventually, or as you get older, you might start to see the signs of it, such as in chronic traumatic encephalopathy
Mhm.
with our football players and
Right.
athletes.
Right, that's what I was thinking is,
Hmm.
this is becoming a little bit more mainstream in the sense of, we hold these athletes to high esteem, and I mean the percentage of football players I think that are now we're
Hmm.
finding decades later that have CTE is astronomically high.
Hmm.
um, and
Yeah.
very scary. And like you said, it can be cumulative. And so something
Hmm.
that happened years ago, and then if you're having, another injury, even if it seems mild, that can be doing a lot of damage.
Oh,
Um,
yes.
yes.
And so, for example, like the movie Concussion, which
Yeah.
really popularized this, um, was great because it help people understand what is actually happening and the whole problem. However, it didn't give a lot of solutions,
Mhm.
and that's kind of the current thinking, is that there's not a lot to be done, when in fact there's hundreds, if not thousands, of studies pointing to the answer and what to do.
Right. And I'm looking at Dr. Chapek's book, and it's over 200 pages of very well researched actionable things. There are some solutions. And as we were talking off the air, there's so much that people can do, even years and decades later, that can help.
Mm,
So I'm very excited to point that out, and
great.
to get into
Thank
some
you.
of that. So when you talk about, in your book, how the typical response from doctors, coaches, and even those on physical therapists that are on the sidelines of sporting events, that treatment often doesn't go far enough, or the assessment doesn't go
Hmm.
far enough.
Hmm.
So in your opinion, what are the elements of a good brain injury assessment?
Yeah. So first is a history. So um, now, if you're on the sidelines, you see someone get injured, of course, that's been documented clearly. But uh, and this just goes back to the silent epidemic thing, is we kind of forget if we've hit our
Mm.
head, and if it wasn't going to the ER, oh, maybe it wasn't that bad. I know I hit my head a bunch of times just falling out of trees and um, skateboarding, and I saw stars quite a few times. And if you see stars, get your bell rung, so to speak, that is enough to cause damage to the brain. The brain is soft. It's like as soft as butter or jello. And the skull it's housed in a very hard skull. The skull is as hard as a rock. And there's many sharp bony ridges that can, if there's enough acceleration, deceleration force to cause whiplash, for example, it's enough to cause brain injury. And the brain is like so soft. If you set it on the table, it's a pile of goo in a few hours. I mean,
Mm.
it's very sturdy. So think back, we ask patients 10 times. We try and ask them 10 times as they come in. And when I started working at Amen Clinics, I thought, really? People surely would remember a brain injury, but it's true. Like, I'll show them their scan and say, okay, surely you've had a brain injury at some point. Um, uh, when was that? Have you sure? We have to ask specifically. Have you ever fallen off of a horse? Have you
Mm.
ever dove into a shallow pool? Have you ever fallen out of a tree, had a car accident, played contact sports? And eventually they'll say, "Oh yeah, I fell out of a second story window when I was 5. Do you think that counts?" And it's like, "Oh my gosh, of course." So first is history, understanding just that's simple, that anyone can do, is to think back. Okay, have how many head injuries have I actually had? And now that I think about it, um, the second thing is cognitive testing. And we do web-based cognitive testing called Web Neuro, which measures thinking scores, attention and memory, and um, emotion scores, depression, anxiety, because that can be part of injury as well. And that gives us a baseline of where someone's at, and then can be retested more objectively down the road. If you're at home and want to do some cognitive testing, there's a number of simple tools that are free. Usually these are doctors doing them, but the SAGE is one, SAGE. It's a cognitive test for dementia and Alzheimer's, but can be used for brain injury or any cognitive problem. The MOCA, MOCA, Montreal Cognitive Assessment Tool, is one of the best ones, and it's simple. It's 20 minutes and a pencil paper test that is again usually done by a doctor. But the cognitive testing that I mentioned can be done on our website, brainhealthassessment.com, and you can measure your cognitive level and different parameters. So that's the cognitive testing. The third is imaging. It's really helpful to get imaging. If you can do and come to one of our clinics, we have 9 clinics across the country now. The closest one to you, Kim, is Chicago, but we've got,
Mm.
let's see, Seattle's where I'm at. We have LA, Costa Mesa, San Francisco. And then on the East Coast, there's Virginia, New York City, Atlanta, Georgia, and then we'll be opening in Dallas in a few years. So you can get imaging done. Um, Doing an MRI is helpful just to rule out the worst, but functional imaging is far superior, I'd say. The other element of assessment is labs. So 25 to 50% of people who have had a brain injury have damage to the pituitary gland. And this is your master hormone gland right in the center of the brain. And if it is damaged, which it is, it's like sort of like an upside down ice cream cone shape.
Mm.
It's kind of heavy on one side and can be damaged easily. The vasculature, the vessels can be damaged. And if it's damaged partially or fully, it's not sending the signal to to the testes, for example, to produce testosterone, or for women, ovaries to produce estrogen, progesterone, the adrenal glands, the thyroid gland, growth hormone. And I was trained by Dr. Mark Gordon, an endocrinologist who really helped me understand how to assess and treat hormonal deficiencies. He's really a master of this and has worked a lot with veterans extensively. And he's in the LA area. And it's just an important piece we don't want to miss. Like, hormones are growth factors and healing aspects. And if you have, for example, low testosterone, especially in men, that can mimic signs of brain injury. Like, it can cause depression, anger, even memory problems. Same for women with estrogen and progesterone. It can really affect brain function and growth hormone for both. So I recommend a really thorough, the best treatment starts with a really thorough assessment.
And so the blood tests that you're referring to, they would be testing for things that the pituitary gland is an association with, like the hormones, like testosterone,
Right.
estrogen, progesterone. That's really
Yes.
interesting. And I think you, in your book, you outlined how, especially going back to like the football players, we think about these big burly men with like really high testosterone,
Right.
but when they are having these brain injuries, that you're assessing them, they actually have extremely low testosterone and are exhibiting some of those things that you're mentioning, like the anger and the memory and the mood swings that actually correlate back to brain injuries that they suffered. So
Right. Yeah, Dr. Yuen in this area, unfortunately, he's no longer with us, but he did research that's parallel to Amen Clinics, where he measured just hormones. He's a endocrinologist as well, and about 20 to 30% of these hulking football players were actually deficient in growth hormone and testosterone. So it's just amazing.
Yeah, it is, and that's not something you would really think. And I bet that that's probably perhaps not something that is assessed. If someone comes in for, a concussion or even like having symptoms in a few months, I would assume that that's probably not something that they're testing for.
No.
But in your book, you did outline, you created something called first aid for your brain, which can be used acutely right after a brain injury or a concussion. And they're just the recommended immediate steps. So what are those steps?
Yeah. Well, I think a little story helps to outline this, is that there was an undergraduate researcher, Theodore Roth, at Stanford, and he got to implant an intracranial microscope into the mouse skull, and then they give these poor little mice a concussion, and watch in real time what happened as the brain's, there's swelling, there's increased macrophages and microglia, which are the macrophages or immune cells in the brain, would swell and try and eat up damaged tissue. There was oxidative damage, and you could actually see that in never before seen footage, real-time footage, and published in the journal Nature in about 2013. And so, but he didn't end there. He then applied glutathione to the mouse skull. And if he applied glutathione, this antioxidant, then there was decreased cell death by 67% and decreased cell death 50% if applied within 3 hours. So there's this window of time in which to act, that when we see a brain injury, instead of just resting and hoping people get better, why don't we do something that we know can quench that inflammation? We know that there's inflammation after brain injury, and it can smolder for months and sometimes years. And so we need to quench that inflammation. And so what I suggest and strongly recommend is that we use nutrients that increase antioxidants and decrease inflammation. And I want to tell you what, and there's specifics in the book, but NAC, N-acetylcysteine, is an over-the-counter supplement, and that's a precursor to glutathione. So I recommend immediately taking NAC, about 2,000 twice daily, 2,000 milligrams. Curcumin, so that's a spice in turmeric. Curcumin is an antioxidant where, and one of the keys for curcumin, it not only decreases inflammation, but it opens up aquaporins. These are water channels, and they can help decrease swelling. That's one of the key things for curcumin in brain injury. Vitamin C doesn't get enough respect. Vitamin C is a water-soluble antioxidant, really important for brain function and decreasing oxidative damage. And so taking a good amount of vitamin C, 1,000 milligrams at least. Vitamin D is as much a hormone as it is a vitamin. It's fat soluble and directs inflammation in the brain. In fact, there was a study done in Iran where they had, after acute brain injury, this was in Advanced Biomedical Research 2012, these were severe brain injury patients, and they gave them vitamin D and progesterone. Progesterone, of course, even for men and women, decreases inflammation, modulates healing, improves healing in the brain. Sort of when in the last trimester of pregnancy, the brain is just bathed in lots of progesterone, actually throughout pregnancy, and that's just a healing environment for the brain. So it's ideal. And there's over 200 studies on just progesterone, but they combined progesterone and vitamin D, over 200 studies for progesterone for brain injury in particular. So they combined these two and reassessed them after 3 months. Many of these patients were in a coma, Glasgow score less than 8. And after 3 months, they measured recovery. Was it 25% was in the placebo group, 45% favorable recovery in the just progesterone group, but the progesterone plus vitamin D group was 60% favorable recovery, which their criteria for favorable recovery was they were able to live a normal life with minimal disability versus some major impairment or death was one of the criteria. So more people survived who had progesterone and vitamin D. So we know that vitamin D is a really key piece, and we want to add multiple things, kind of layer multiple treatments together. It seems like a lot, but it's NAC, curcumin, vitamin C, vitamin D, omega-3 fatty acids for cell membrane support that help cell membrane stabilize, it decreases inflammation. I really like modified or medium chain triglyceride oil because there's damage to the glucose transporters, so the brain's not getting enough fuel, and MCT oil can help as an alternative fuel source for the brain to increase ketone production. Branch chain amino acids. This is a supplement that sometimes is used by weightlifters and athletes, but actually helps with recovery from any kind of injury, including brain injury, and especially acutely. So I recommend taking all of these things, and there's more details in the book about how to use them and dosing, and kind of follows a protocol where I got this idea because the mouse study, but then there was a military study with 81 active duty military service members, and they gave them NAC, which I talked about first, if they were suspected of having a concussion from a blast injury in the field. So they'd run to the medic, hey, I had a concussion, or they were carried to the medic, and they were given large doses of NAC. They gave them 4 grams immediately, and then 2 grams twice daily for 4 days, and then 1.5 grams twice daily for the second 2 days. So they gave them for about a full week total, and found that those who were given NAC recovered at a rate of 86% versus those who weren't given NAC recovered at a rate of 42%.
Wow. That is incredible. And this is something that our military, I'm thinking, should have
Yeah.
always on hand,
Yes.
because they're constantly exposed to blasts of different sorts,
Hmm.
and even in training.
Hmm.
Um,
Yeah.
but just that these are things, this is not something that you have to go out and get a prescription for. These are
Right.
things that you can pick up. You can have it on hand, especially if you
Hmm.
have children playing sports,
Yes.
or things that it could be a potential that there could be someone. I'm even thinking nursing homes, where we
Hmm.
have elderly people falling, and these are supplements that we can purchase to have on hand, and we
Yeah.
know that they can decrease swelling. They flood our bodies with antioxidants, decrease the
Hmm.
inflammation. So that's one thing that I think is such an important takeaway from this, is just that
Hmm.
this is not something that you have to say, well, I have to go to the doctor and get a prescription, and I can't have this. You can have these there right on hand. So I
Yeah.
think that's one of probably one of the most important points of your book, is that it's giving
Yeah.
us, it's empowering the person, and
Hmm.
empowering the consumer, I guess. Um,
Yeah. Yeah, I
yeah,
agree with you. They should be, this is like a TBI first aid kit that should be wherever you'd have a first aid kit, which is
right.
everywhere.
Yeah,
You should have ready
exactly.
because your brain's just too
Right.
precious. It's like kind of like rice. We know rest, ice, compression, elevation after. Even, my son plays basketball, and, one of the kids will twist their ankle, and even before they've been assessed and is it really a sprained ankle, someone's grabbing ice and applying ice just right away, and it's like, but then when someone hits their head, we had a unfortunately, yeah, one of the kids fell and hit his head pretty hard. Everyone heard it. It was this crack around the court, when his
Yeah.
head hit the wooden slats there. And everyone just kind of, okay, let's see how he does. Let's watch him. Let's check him out, which is good. You want to do that first, but then let's also be giving something that actually helps his brain to heal. Just because we can't see the swelling doesn't mean it's not happening.
Now, we'd like to take a minute to give a shout out to our show partners, Perfect Supplements and Amazon. Perfect Supplements is a family owned and operated business that supports local farms. Their superfoods and supplements are non GMO, third party tested for purity, and contain no synthetic ingredients, colors, or flavors. They're also organic or wild harvested and fairly traded. Products range from collagen and bone broth powders to plant proteins, greens, desiccated liver, and adaptogenic herbs. Perfect also carries vitamins and supplements from other reputable sources, like Just Thrive, Dr. Mercola, Gaia Herbs, Green Pastures, Garden of Life, and Prescript Assist. To check out their wide array of products, go to perfectsupplements.com/Kim. If you use coupon code KIM10 at checkout, you'll get 10% off your order. This is a great way to get superfood nutrition while helping to support our podcast. And just as a disclaimer, it's not the intention of our podcast to provide specific medical advice, but rather to provide you with information to better understand the role of dietary supplements in health. We urge you to consult with a qualified health provider to discuss both the advantages and risks of using dietary supplements. Our other show partner, Amazon, is the largest online warehouse and carries just about everything you need. If you shop on Amazon, which is likely, you can support our show at the same time at no additional cost to you. Simply use our affiliate link to enter the site, then browse and buy, just as you normally would. A Whole New You podcast will make a small commission from your purchase, which helps to support production costs for the show. You can find a clickable Amazon link in the show notes for this episode. You can also go to the products page of our website, awholenewyouPodcast.com, to find the link. If you love our show and appreciate the free information you get each week, please consider buying from Perfect or using our affiliate link when making purchases on Amazon. Now let's get back to the show. So those are things that you can do, in the acute phase. What if someone has had a concussion in the past or a traumatic brain injury even years ago? Would you still recommend that they take these supplements, or
Yeah.
what kind of
Yeah.
supplements do you recommend?
Yeah. So most of the research is on acute brain injury. But we know that when we study patients who have had chronic symptoms and chronic problems, brain injury problems, many of the mechanisms are exactly the same, and many of the treatments will work similarly. So we still need these nutrients: NAC, curcumin, vitamin C, vitamin D, omega-3 fatty acids, maybe just not as high a dose initially,
Okay.
and you don't need the branched chain amino acid powder. Um, Diet is even more important. I had a patient who was getting tired of taking the supplements. He's like, okay, what's the one supplement I can take that will help me with brain injury? This was a pilot, airline pilot, who had been punched out in a bar
Oh,
um, in Australia, and he was having difficulty flying. He couldn't fly home after he was punched out,
oh my.
and so he wasn't able to work. He was really struggling, couldn't sleep well, and patients with brain injury, it's hard to do things like
Mhm.
sometimes it's hard to take these supplements, and so he's like, "What's the one supplement I can take?" And I said, "Well, let's just scrap the supplements. Let's just focus on your diet." And I
Mm.
told him to try the ketogenic diet, and within a few weeks, his energy improved and his sleep improved, and then he started feeling better. And he's like, "Okay, then now I can take more supplements again." Um, and that's a real key because the glucose transporters have been often damaged after brain injury. And so your brain uses 20 to 30% of calories in your diet. I mean, it's a very hungry organ. And if it's not getting enough fuel, you're going to have fatigue and difficulty concentrating and depression potentially. So, how can we get the brain the nutrients that it needs and the fuel? If you do a ketogenic diet, which is essentially a really high fat, really low carbohydrate diet, I'm talking less than 30 grams of carbohydrate a day, it forces the body to burn fats and ketones for fuel. And the ketone bodies become a fuel source that can go into the brain almost like by osmosis. They don't need as much energy to be utilized by the brain. It takes some energy and various steps to use glucose for fuel, whereas it doesn't take as many steps to get these ketone bodies to fuel the brain. So that's kind of why that is why a ketogenic diet I recommend at least trying for everyone that has a brain injury to help improve many of the symptoms. It's not for everyone. It's hard to do, but it's really powerful. It's a therapeutic diet to at least consider. So,
Absolutely. We
yeah.
hear so much about ketone diets, even for epilepsy and other brain ailments too.
Hmm.
And I'm thinking that, the MCT oil that you mentioned, we know that that can help provide the brain with fuel and energy
Hmm.
as well. So that in
Yeah.
combination would be probably very powerful.
Yes, exactly. I would say MCT oil helps enhance the healing effects of a ketogenic diet and make it easier to stay in ketosis and have more fuel for the brain if you use MCT oil. So you're exactly right. I agree with
Mhm.
you.
So you've listed some supplements. What other kinds of therapies do you recommend in the treatment of TBIs?
This is how I format it. So first, we need to sort of reconnect the wires. We want to have all of the antioxidants and nutrients on board. Um, Getting exercise, so
Mhm.
diet and then exercise, and used to be just rest, but now many of the concussion protocols include exercise, which I'm so grateful for. And it should be exercise as much as you can as soon as possible after injury. And that doesn't mean overdoing it. It means exercising up to the point before symptoms. So if a 15-minute walk causes headaches or light sensitivity to come back, try 10 minutes or try 5 minutes or just do some yoga or stretching. It may be too much too soon, but you do want to kind of push it because we know exercise increases BDNF more than any supplement or medication. BDNF is brain derived neurotrophic factor, miracle grow for neurons,
Mhm.
uh, and it increases blood flow. So we know there's less blood flow to the brain. So I also recommend um, brain exercises to rehabilitate after you've kind of done the basics. Sleep should be good and under control, hormones corrected, nutrients and supplements, diet, and then retrain the brain with brain games. So the same pilot I was telling you about, the airline pilot, one of his keys to success was doing brain game exercises. So there's a lot out there. We have one, My Brain Fit Life, which is you can do online brain training. There are other programs like Brain HQ. Dual and Back is the one that he actually used to help improve his ability to concentrate, plan, focus, and kind of just retrain the brain. And you don't have to do, some people aren't into doing online computer games and brain training. Meditation, really effective brain training that is age old. We've had meditation around in some form since the beginning of humans. And so I really think just doing simple meditation exercises is like one of the best, and has been shown in studies to improve quality of life, decrease fatigue in patients who have had brain injury. And I got to mention hyperbaric oxygen.
Yes, I'm glad.
So hyperbaric oxygen is a hyperbaric chamber that is pressurized. So think about divers who have had the bends. They come out, they need to be put into this high pressurized chamber breathing oxygen to help decrease nitrogen in the blood. And the same technology is used for strokes to increase oxygen to the deeper structures that haven't healed. And so that's why we use it for brain injury, and it's very effective. If I had one magic bullet, just the one thing I could do for brain injury, one treatment, it would be hyperbaric oxygen. If I couldn't do anything else, I would do that. However, it's so much better if you do the other things I was mentioning first: diet, exercise, nutrition, supplements, sleep, brain training. Plus, then if someone plateaus and they're not getting better, adding hyperbaric oxygen therapy really boosts recovery because it turns on 1,000 different genes, healing mechanisms, increases blood flow to the deeper structures that haven't healed. And it is costly and time intensive. So that's another reason to layer it in after you've done the basics first. But if you have the money, the time, and just you need to get in there as soon as possible, like we have a hyperbaric chamber here in our clinic. If I had a brain injury, I would be jumping in there as well as taking supplements, and myself or a loved one, we would do it also, but just not always practical.
And I think that's important. What you mentioned is just layering these, just doing as much of these positive things as you can, or that you can afford,
Yeah.
Whether it be diet, exercise. I think in your book, you did mention in regard to exercise that cardiovascular exercise tends to be a little bit better for the brain versus some other kinds because of the blood flow. Is that correct?
Yeah, exactly. No, thanks for mentioning that. It's aerobic exercise, and interval training is very helpful. In particular, the more intense, the more BDNF is released, the brain-derived neurotrophic factor.
Okay, and we all want that. So
We want that for sure.
Right. You did touch on for just a moment sleep, and I do want to talk about that for a minute. One common thought that I know now from reading your book is that it's a misconception or a myth that someone with an acute concussion should not be allowed to fall asleep. And so I want you to address that first of all, and then also talk to us about why sleep is so important after a head injury.
Yeah, there's this myth that you shouldn't let someone fall asleep after a brain injury, but really the brain needs to sleep, and I'm so glad that has changed. But it's sort of like, okay, but I thought we're not supposed to. So when is it okay? Well, if someone can't stay awake, like they can't be, they're just passing out, they could have a brain bleed. That's where this came from, is that they thought maybe they're falling asleep, but no, they maybe had a brain bleed and were actually going unconscious. If headaches worsen, they're having seizures, they're having neck pain, change in behavior, um, repeated vomiting, they're slurring their speech, they're irritable, can't recognize people or places, very disoriented, increased confusion, weakness or numbness in the arms and legs, not responsive, those kinds of things. That would be seek urgent care. You know,
Mhm.
don't. And then if the urgent care has said, okay, no brain bleed, things are fine, CT, MRI normal, then let them sleep
Mm.
the first week as much as possible. Um, and then some people have a lot of difficulty sleeping. That's one of the curses of brain injury is that um, most folks have a lot of difficulty. Like they're drowsy during the day and then they can't fall asleep at night. And it's just horrible because you have to have sleep to heal. That's when hormones are released in deeper stages of sleep. That's when the brain can rest and detoxify and restore. So it's funny. I was at a brain injury conference giving a lecture, and someone asked, "Why is every patient, or why do we all have problems with sleep?"
Mm.
And I said, "Gosh, I know that's true, isn't it?" But I didn't know the mechanism, so I went and researched it, and there's less melatonin, which should be not a big surprise. Less melatonin is released in the brain, and the pineal gland perhaps is damaged, and the hormonal system is damaged. And part of it is there's less hypocretin. Hypocretin is this hormone associated with wakefulness. So people are not as awake during the day because they have less hypocretin, makes people awake. So there's this, and then just the neurons are damaged. They're not functioning well. It's kind of like a light switch that's flickering, or fluorescent lights flickering overhead. I don't know if you've seen the movie Joe versus the Volcano, but there's a scene where it's dingy office and the lights are flickering and he's like bothering him and he's half awake. And it's kind of like that with brain injury. The neurons are kind of flickering, not really on, not really off. So it interferes with sleep. Um, and so some strategies are to melatonin, of course, is an antioxidant. There's no risk of dependence on melatonin. There's a theory that if you take melatonin, it suppresses your own production and it might cause more problems with sleep. However, that's just not the case. It's You can take large doses of melatonin forever, and your body will produce its own melatonin again the next day.
Mm.
Yeah.
It's good to know. Yeah.
Mm-hmm.
I think in your book, you also mentioned tryptophan as being something that someone could try.
Really
Is that right?
helpful. One of my faves,
Hmm.
tryptophan,
Okay.
and it's different than 5-HTP. So 5-HTP, they both increase serotonin. So that actually tryptophan to 5-HTP to serotonin. This is an amino acid precursor to serotonin and melatonin. And even though 5-HTP is one step closer biochemically to melatonin and serotonin, tryptophan is much more sedating and helpful for
Mm,
sleep. I don't know why, but that's just
interesting.
what we've seen. Yeah.
Yeah, that makes sense.
Mm-hmm.
So in your book, you talk about not knowing that, maybe we're talking about someone who doesn't remember that they had a brain injury, or maybe it was a long time ago, and maybe they're having symptoms decades
Mm.
later, that maybe they don't know if some of the problems they're dealing with in regard to, let's say they have issues with attention or
Mm-hmm.
memory or depression, and they're not
Mm-hmm.
sure if that could be related to a past brain injury. How would they be able to know if
Mm.
that was due to a past injury or not?
That's a great question. I would combine the various components we talked about, like the history, first of all, and see, okay, is that one of my risk? It's almost like a risk factors. Is that one of my risk factors? If you can do a brain scan, by all means, that would be the
Hmm.
best thing to do. But if you can't do a brain scan, you do the history, you do some cognitive testing, you do labs to see if there is pituitary deficiency, and put those together. And then certainly try and help heal the brain. It's it's not 100%. Like, we can't say all of your current symptoms are due to a past brain injury.
Right.
There's other things going on, humans are complicated creatures. But if you have a history of brain injury and you have some deficiencies in either nutrients or hormones, sleep problems, it's at least worth trying and considering to focus on healing the brain. I'll give you one example, and this is really who the book is for, is two groups. One group that has had a brain injury and hasn't gotten better, and then a second group, which you've just clearly really highlighted, which are those who have had some other mental health issue, perhaps depression, anxiety, memory problem, and it may be due to a brain injury. And I would suggest, I think there's a huge amount. It's in my past 12 years working in mental health, it's one of the number one causes of brain problems is mild concussion, brain injury. So it's definitely worth treating.
Before you go, because I know this is one of your specialties too. I'm thinking about dementia and Alzheimer's. If people are worried about that, if they have a loved one who might be experiencing that, or they're worried about it for themselves, could some of the treatment protocols that you're talking about, as far as supplements and diet and exercise, can that pertain to folks with dementia as well?
Great point. You're so smart at putting these things together. Yes. Dementia, there's many underlying mechanisms that are the same. And those are my two loves, is working with people who have dementia and those with brain injuries, because many of the underlying mechanisms are the same. There's some differences as well. But for example, the glucose transporter issue, same. So ketogenic diet, worth a try for both. We need nutrients that decrease inflammation, that improve blood flow. There's a few different nutrients I would use for Alzheimer's or dementia versus concussion, but many of them would apply to both. So yes, absolutely. Many of the treatments are the same.
Okay, that's good to know. I'm thinking
Right.
this runs the gamut of all ages, where we can talk about young kids who might be experiencing concussions. We can talk about maybe people that are middle aged who may have had something in the past, and then as we look towards our elderly population. So that this book that you have so wonderfully worded and published is really for everybody, because there are so many tools that we can all use to better our brain health. I so appreciate you being on the show today and taking time away from your extremely busy schedule. And we are just so happy to tell our audience your book is now available. This episode will be out in February, but it is January as we speak, and your book was just released
yesterday.
Recently. Yes, recently. Yes, yesterday. I saw a picture of you on Instagram.
I'm new to Instagram, so thank you. Yes, trying hard. Yeah. Thank you so much. Yeah.
You're so welcome. How can people find you or connect with you if they wanted to?
Well, our clinic is Amen Clinics Northwest, so you can Google that. That's probably the easiest to find us here. And yeah, I'm on Instagram and Facebook, and we're here. You can call us. Books is available on Amazon and wherever books are sold. I just want to mention that, it's never too late. It's never too late to at least try to help heal an injury or a mental health or brain health problem. It's always worth relooking at the whole picture. So don't give up.
Wonderful. Great, hopeful words for all of us. Thank you so much for being with us today.
My pleasure, Kim. Thank you.
That's it for today. For more from Kim, you can go to kimmaravich.com. For more from Lori, go to simplympoweredllc.com. We're always open to listener questions or suggestions for the show. You can email those to contact@awholenewyoupodcast.com. We'd also love it if you joined our Facebook community and followed us on Instagram. Just search for A Whole New You Podcast. And lastly, if you'd be so kind as to leave us a rating and review in iTunes, we would really appreciate that, so more people can find our show and join our community. We'll see you next week.